Hospitalizations can be scary and stressful and overwhelming, no matter how many times you've gone, but especially when it's your first one and you don't know what's going to happen or how long you'll be there, you don't know what to expect. Well, I have had many, and I'm here to help you through your first hospitalization. Now, even if you've been hospitalized before, I hope that this video can at least be fun for you, because I do want it to be somewhat lighthearted and not too serious, while also going over the realistic expectations of a hospitalization. To start with, I'll just go over the intake process, or at least how it's gone for me. And this is going to be under the circumstance that you are voluntarily admitting yourself, not like an involuntary hospitalization where you don't know what you're getting into. You probably don't even know that you're going to end up in the hospital. But if you can be prepared, I just want to start with your bag, what you would bring. Now, they don't want you to bring a lot, and you'd probably be best off to bring 3 shirts, a couple pair of pants. You definitely want something warm, like a sweatshirt, not a hoodie, not with strings. You want something a crew neck where you can't choke yourself. They won't let you have things like shoelaces, so probably bring some slip-on shoes or slippers. Warm socks. You want to stay warm because these places are really cold. You'll want toiletries. I would suggest keeping it simple because they do have stuff there. They have soap and shitty tasting toothpaste and little bottles of multi-purpose detergent shit. But definitely bring your toothbrush and deodorant. The deodorant wipes they have kind of suck. For entertainment, I think books are a great idea because there's a lot of time to kill. And if you like writing, I would not bring a spiral bound notebook because the wire is dangerous, so they won't let you have that. But a composition notebook would be fine. And you probably can't have your own writing utensils, but they will have rubbery, weird, safe pens. And most importantly, you'll want a list of any medications you take. You'll want contact information for your doctor, like your psychiatrist or therapist or primary care doctor, and phone numbers of the people you'd like to stay in touch with when you can make phone calls from inside the hospital. Anyway, that's just a start. That's probably way more information than you need, but maybe it'll help. I don't know. I'm going to make a part 2 soon, so look out for that. Welcome to part 2 of what to expect in a hospitalization from my cozy corner. Now, let's say that you have your bag packed and you're all ready to go admit yourself to the hospital. There are a couple of ways you can get admitted. One way is through the ER. I have used this method a few times, and it's okay. It's okay. It takes a long time just to get out of the ER onto the floor. I think the longest I've waited was maybe about 9 or 10 hours. And I think that's because, unfortunately, psych patients aren't super high up on the triage. So they tend to wait really long times to get through. And you'll probably talk to some sort of a social worker, and they will kind of assess where to put you. And so if you stick around and you eat some snacks, you might make it onto the psych ward. There are also hospitals that are designated for psychiatric emergencies and mental health and all that fun stuff, and they'll have outpatient programs and they'll have inpatient, and if you're looking for either of those services, you can actually go directly to those hospitals and do an intake process through them. It's a little bit shorter because you're going directly to the source, but I will warn you, it is still very long and it will take hours. I think typically for my stays, it's been about 4 to 6 hours, although the longest one was about 15 hours. And that was only because while I was going through the intake process, I got really triggered and I punched a wall so hard that I broke my hand. So they took me to the ER and I had to get that fixed up. And then I came back and started all over again. It was very, very exhausting. I would not recommend punching walls. Okay, so now you know how long it is. Well, why is it so long? What are you doing? There's a lot of paperwork, and you will basically be giving your life story, and it can be very emotional because They will want a full medical history of you and your family. They will want to know about your medications and your disorders, which is why it's good to bring like a list of medications that you have on hand. If you don't, I would recommend writing up a document on Google Docs, which I actually just used in an appointment today. Some of what they ask you is going to be very hard to answer, and even after a dozen hospitalizations, I still get choked up going over some of the personal details because they will want to know about, you know, any abuse or trauma or substance use or anything that can be very triggering, very hard to discuss, and it's completely okay to cry. I don't know if I could ever get through it without crying. Then once they've done that initial assessment and all of the background work and blah, 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 paperwork, you will be taken onto your floor. And sometimes it's just like a unit, one unit with like a wing on either side and then a room to chill in, very small. Other times, like I said, it'll be an entire hospital and they'll have entire floors and units that make up like a whole freaking huge maze of areas. And if you have especially bad trauma in one area, they'll put you on that unit. And if you have more of a substance use problem, they'll put you on that unit. Both are great kinds of care. Really just depends on what you need. At this point, once you've made it into your unit, it's almost done. You're almost done with the process, but you're still not out the gate yet because the nurses will want to go over some stuff with you and there will be more paperwork. And at this point, you'll be like, I am tired. I just want to go to bed. I have been crying. I've answered everything you have asked of me. What more could there be? Unfortunately, there is one more thing that can be kind of uncomfortable, and that is the skin check. The skin check is pretty much exactly what it sounds like. Basically, you go off in a private room and you strip down, and then two nurses will come in and one of them will evaluate your body and basically go from head to toe and mark down on a sheet of paper everything they find, like marking, bruising, cuts, burns, scars, even tattoos and piercings, and they keep a record of it, and it can feel very invasive, and I never don't feel uncomfortable, but that is pretty much the last thing in the intake. And after that, you can go take a deep breath, you can go lie down in your new plastic bed, and you've just gotten through the worst of it. So congratulations, you are now on the floor. That's it for part 2, and I will make a final part eventually where I talk about the actual experience of like being there, you know, the duration, your cray vacay, and all that entails. What to expect in a hospitalization part 3. So at this point in my little video series, your imaginary patient is now on the floor and you have gone through the intake and you are finally on the unit, and welcome to your hospital stay. What exactly does that entail? So first of all, let's be realistic about the amount of time you will be there. Typically, the shortest amount of time is 72 hours, 3 days. That's pretty standard. I don't actually see a lot of people leave that quickly. From what I've seen, it typically tends to be like 5 to 7 days. Sometimes places are understaffed and they just can't get you out that quickly. For me, my hospitalizations have on average been about 10 to 14 days. My longest one was a month. Hospitalizations can go pretty long, though. I've heard of people being there for 90 days or a year. Some places you just stay indefinitely. It really just depends on where you're at and the level of care you need. Then addressing the reason you're really there, you will have specialists who will help you stabilize. There will be like a therapist or social worker that will help you come up with goals for while you're there and plans for your release. And they will probably be the ones who kind of come up with the day that you will be released. Then there will be a psychiatrist who will help you get stabilized on meds. That is like a large part of the waiting game in the hospital, is just stabilizing on meds, because it can take a while and you might have to try different methods, but they want to get you on a stable enough dose to have you released. That's pretty much the game. As far as what you can do while you're there, that really depends on like the facility you go to. I've been to this one place 3 times where there's really not a lot to do. They have books and they have a TV and that's it. But I've been to some really great places that have groups, and they have an art therapist and a music therapist and a physical therapist, and you can do yoga and you can play guitar and you can do watercolor paintings. The groups will be things like dialectical behavioral therapy and mindfulness, and they'll have like an entire schedule of activities that you can do, activities and groups, and it really is like all across the board, a different experience depending on where you go. So about groups. Groups are great. Groups are an awesome opportunity for you because you will learn skills that you can use outside of the hospital. You will have some time to kill doing something active because otherwise you'd just be bored out of your mind. And if you utilize the opportunity to go to groups by going to as many as you can, you will probably speed up the process of you leaving. Like, your stay can be determined by your involvement in the groups. So go to as many as you can. Try not to miss them. Try not to nap through them because they can actually help you get out of there. What also can help you get out a little more efficiently is just good behavior. That's it, just good behavior. I know it doesn't sound like a tall order, but in a hospital setting, it really does go a long way. A lot of people in that setting tend to act out, and there can be a number of reasons that they might be in seclusion or put in restraints or booty juiced. I don't know if that's still a thing. Like, I'm sure that's an outdated term, but booty juicing is what it sounds like. It's getting a sedative in the ass, and I've seen it happen, and I've been on the receiving end of like seclusion and restraints. So these things, they just keep you there a little bit longer, and if you can stay on your best behavior, it'll go a lot more smoothly. So it's long and it's boring, and you'll probably do a lot of coloring, but that's essentially the gist of a hospitalization. I'm sure I left out a lot of stuff, but like that's kind of the bare bones of it. That's basically, from my experience, what I think you can expect in a hospitalization. Up until this year, I wasn't able to get a therapist because it just wasn't accessible to me. So instead, I taught myself DBT, and as a result, I came up with my therapy bag. So I'm just gonna give you a peek into what that looks like. This is my therapy bag. It's just a simple tote bag, and inside I have distress tolerance tools. So for instance, I have these note cards, and on every note card is a different distress tolerance technique. So there's like, go outside and listen to nature sounds, hold ice, clean as much as you can handle, draw or paint on myself, especially when I want to cut. And these are all things that I've used. I've genuinely used them, and it's gotten to the point where I've kind of memorized most of the cards, so I don't really need them anymore. I also have soft little buddies that I can like kind of cuddle, and they're small enough to fit in my bag. I have an art journal to work through with little prompts. I keep snacks. I have an emergency clown nose, which is a good way of indicating to people I'm with that I need to leave. And I finally have some pretty rocks. This one says hope. I also keep my meds in here, but I'm not going to show that to you just for like privacy reasons. Anyway, this has helped me a lot. It was a big game changer in my progress, and it's something that I did all by myself. I've actually grown a lot since I started using it. It genuinely does help. I also have one for on the go. It's a lot smaller and it fits in my backpack. So that's what I got to show you today. I'm private about what medications I take, and that's because over time, I've come across situations where talking about my meds actually did more harm than good. So I have a few reasons for why I don't talk about that, and I think they're pretty fair. First of all, I don't like comparing meds, and a lot of times it turns into a competition for who's worst off. I just don't want to be a part of that competition. For instance, one time I was talking with a guy about a med that we were both on, and he asked me what dosage I was on. I said I was on 600 milligrams. And he got all proud of himself and was like, well, I'm on 800 milligrams. And, you win, I guess. Cool. Another time I was talking with a friend of mine about a med that we were both on, and she asked what dosage I was on. And I said I was on 120 milligrams. And she was shocked. And she said, I'm only on 40. I was honestly kind of embarrassed by that. I didn't know it went as low as 40. People have wildly different regimens, and people respond differently to different meds or different combinations of meds. It's not just about the severity of your mental illness, it also factors in your body composition and how well your body responds to different meds. Some people are treatment resistant and other people respond well immediately. Taking a high dose or a low dose isn't a clear indicator of how severe your mental illness is, so comparing medications is just splitting hairs. Also, some people want advice, and I'm not qualified to share on that. I only know what works for me, and something that works for me might be exactly what harms someone else. Side effects vary from person to person. I've had tardive dyskinesia from one med. I've had weight gain from several others. I've had a psychotic break as a result of a dangerous combination of meds. I've had several embarrassing side effects that just aren't worth mentioning. My sister actually had to go to the ER because she got a full body rash from a medication that gave me no side effects. And this is someone who shares my genetics. We don't even respond the same way to certain drugs. And in case that wasn't complicated enough, I've been medicated half of my life. I'm 30 and I went on meds when I was 15. And it wasn't until very recently that I actually became stable. So that's half of my life that it took just to become stable on medication. And that was trying like over 20 medications. Ultimately, none of these reasons even matter. If I don't want to share about what meds I take, that's a choice that I have the freedom to make. I don't need a reason or a reason why not for why I don't want to share about certain aspects of my life. I'm allowed to have a private life. I can have a public life and a private life. I'm allowed to have boundaries and be able to say no at any time. I don't owe anyone anything. Just because I speak openly on the internet doesn't mean that my life belongs to the internet. I have autonomy, and I can't believe that I even have to say that.
Can you talk about any physical side effects you've had from mental health meds? Yes, absolutely. I was a little hesitant to answer this question because I sometimes talk about embarrassing stuff on here, and I wasn't sure if this is something that I really wanted to make public, but honestly, the reason I talk about embarrassing stuff is not because I'm necessarily looking for attention, because why would I want attention from that? But because I want to normalize this shit. I want people to feel like it's not embarrassing to talk about their side effects. I want people to feel less shame and less isolation. I want people to be able to know that this stuff is perfectly normal. That being said, there are 3 side effects I can think of from all of the various medications I've taken that have impacted my life in a major way. The first and most common one, and I don't just mean most common as in it's happened on most of my medications, but most common because it happens to a lot of people, is weight gain. That is the most common one I can think of. I hear that from so many people. For me, I have been on multiple medications that have caused weight gain, and I would go on a new medication and then gain a lot of weight and then slowly lose it all, switch medications, gain a lot of weight, and slowly lose it all. So I have yo-yoed back and forth drastically for years. At my smallest, I was 130 pounds. At my largest, I was 200 pounds. And this was back and forth and back and forth and back and forth. Very drastic physical changes happening rapidly. And, you know, it made me feel very uncomfortable because I was so obviously going through these weight changes and I was adjusting to looking entirely different because I had never seen myself with that much weight before. It greatly affected my self-esteem and my self-confidence. I think mostly just because I wasn't used to this new appearance and I didn't know how to feel comfortable in my skin with a completely different body. The next side effect that drastically affected me was tardive dyskinesia, which basically affected the motor functioning of my mouth and feet so that they were just constantly moving. And it looked sort of like something like that. And honestly, I felt so self-conscious about this, mostly because I'm sober and I'm in a sober community. So most of my friends and the people around me are also sober, and a lot of them are recovering addicts. So they know what a high person looks like. And I looked pretty fucking high. So it made me very self-conscious, like I said, and I would often try to find ways to like hide my mouth and try to like, you know, make it a little more discreet. Thankfully, I was able to get rid of that after getting off the medication that caused it, but for some people it's permanent. So I feel really lucky that I was able to get out of that. And finally, my last side effect scared me the most. It was the one that really freaked me out because I never would have seen it coming. And it was lactation. I actually lactated on 2 of my different medications. And I didn't know what was going on because I've never been pregnant, and all of a sudden I was lactating. So that was really freaky, and I was very concerned about that. I actually went to the doctor, who sent me to an endocrinologist, and he had me do an MRI, and my prolactin levels were like through the roof. And he finally realized that it was my medications, and he was like, "Oh, this is fine. This is nothing to worry about." And I was like, "Really? What? Like my meds did this?" And after getting like not embarrassed enough to be able to talk about it with people, I found out that it is relatively common. And I've now known 4 people who have also randomly lactated because of their medication. This one took forever to go away, and after going off of both of those medications, I was still lactating for like 18 months to 2 years. Thankfully, my medications today seem to be perfectly balanced, and I don't really have any medication side effects like I used to, but it did take me fucking 15 years to find the right regimen of medication. Trial and error, trying like over 20 medications for 15 years. So it's a time game, it's a patience game. You will often feel like a guinea pig or a drug mule because you'll never know what works until something clicks. But that's okay. Once you get there, it'll all be worth it.